Today is an exciting day for me because in '09, that's when the journey started for me, right? I walked into Don Sebastian's office and I told him that the government had these regional extension center programs that they were opening up grants for. There's 62 of them in the country. I was finishing up my master's program, and he was the senior vice president of research and development, and he said, okay, we've done extension before in the manufacturing business. And that led to a $23 million award. That led to 4 years of hard work in converting the state of New Jersey that was at 15% electronic health record penetration to 85% today. Now, that doesn't happen without government intervention, but it brings us to where we are today. So when we fast forward to 2013, and Dr. Bloom's infinite wisdom of making sure that we form an organization where industry sectors can go to one place to access university resources that had never been touched in New Jersey. That's a great opportunity. Tom and I come from a long background in healthcare IT, and that enigma of the university and what's inside, what's possible, is what we really believe this partnership's going to do for us today. Today's ribbon cutting celebration helps us commemorate a very important day for NJII and the Healthcare Delivery Systems iLab, allowing us to reach another milestone in our organization's growth. Having President Bloom, Dr. Sebastian here along with Hackensack Meridian's co-CEOs John Lloyd and Bob Garrett, and their Chief Innovation Officer, as well as our friends and partners from the Department of Health, underscores the impact our lab and NJII's ideation program for healthcare will have on an industry in the months and years ahead. And as Mr. Gadd already said, and we're already moving those wheels. Things are starting to happen really fast. It's not an idea, it's actually in action. Having HMH as a charter member, brings us a living healthcare laboratory with 13 hospitals, 200 locations, 28,000 employees, and over 6,000 physicians. That is a great place to be to solve problems, to figure out what's in those unattended queues so that other people can do their job. And that's something that we like to do very much. NJIT is a STEM university with students and faculty focusing on making the world a better place through engineering, big data, artificial intelligence, virtual reality, gamification, and many other disciplines that we continue to explore and evolve. And here, right in this lab, we will be able to focus those energies to spark what I hope will become a stream of disruptive healthcare innovations that are so revolutionary that hospitals, providers, payers, and consumers will be compelled to take notice. We all know the costs in care are too high and that our healthcare system is too complex. We all agree that steps need to be taken to move us forward towards achieving the healthcare triple aim. And we all understand that healthcare, by its very nature, is slow to act, and institute reforms are not any faster. And this reality is simply no longer acceptable. Hackensack Meridian Health is building a culture of entrepreneurship and innovation. This is the first thing that Dr. Pecora charged us with. That's what he wants, well, you all want, from everybody that works in the organization. No idea is a bad idea. Everything should be vetted. That's the plan. I'm proud of what we've been able to accomplish. Proud of my team. In the last 3 years, we've gone from 12 people to over 100 in 3 different states doing this great work that we do. And the leadership of NJIT, NJII, and Hackensack Meridian Health, without whom this ceremony would not be taking place. And in closing, I thank everyone for being here as part of our celebration, for our partnerships, and for the great successes we will achieve as a result of our collaborations. Thank you.